Excellencies, ladies and gentlemen, esteemed distinguished panelists, it's my pleasure to welcome you to this very important discussion this morning. You know, we have a catchy title, but I think what's behind it is basically how do we prepare.
Yo, what's going on, family? I am doing a reaction video of Davos, and these people are actually talking about another pandemic, which is called Disease X. I don't know if you heard of it. If not, I suggest you look that up. But yeah, yeah, these they're actually gonna go all out with this. So let's check it out.
Prepare for next emergency. How do we prepare our health system overall for next pandemic? We all know very well, there will be viruses, there will be pathogens, there will be outbreaks. The idea is how do we prepare to contain those? How do we prepare outbreaks from becoming full-blown pandemics? We have been working on this for some time. Actually, this session links very well to some of the initiatives that the Center for Health and Healthcare at the World Economic Forum is working on. By the way, my name is Shyam Bishain, and I head up the Center for Health and Healthcare at the World Economic Forum. So we've been working on this. There is an initiative called Partnership for Health Systems, Sustainability and Resilience. Many of the folks here in the room are working with us on that. Basically, the idea is how do we prepare, as I said, how do we prepare the health system to respond to not just pandemics, but also other crises. We know there is a looming crisis of climate change that's going to impact our health system. How do we?
You mean how do you solve something that you create? I mean, let's keep it 100. Something that you guys created in a lab, yeah, in a laboratory, and released out onto the public. So you create the problem, and then you come and be the saviors and solve the problem. But that's how these people operate. That's how they roll.
How do we respond to increased number of diseases, whether it's communicable disease, non-communicable disease? We have to prepare the system well for that. So that's an important discussion here. We also have initiatives in terms of biothreats, disease surveillance. How do we make sure that we have a good global disease surveillance? We have data systems that can be accessed quickly so that private sector can do their job. They can come up with medical countermeasures, whether it's vaccines, diagnostics, or therapeutics. So we've been working on that as well. We are looking at vaccine equity. We are looking at ways to make sure that there is manufacturing in various parts of the world. Africa was a big example, making sure that we have capacity there to make vaccines in case there is another pandemic. So those are some of the things we've been working on. But I think today we are really grateful for this distinguished panelists here to talk about this. Without taking much time, I will hand it over to our excellent moderator here, Dr. Nancy Brown. Nancy is the CEO, Chief Executive Officer of.
Keep in mind, family, all these people are pure evil. Pure evil, man.
American Heart Association. Nancy, I will hand it over to you to introduce the panelists and take it on from here.
Thank you. Thank you, Shyam. Thank you all so much for attending this very important discussion. And I appreciate your opening comments. I have the highest regard for the Center for Health and Healthcare and the work that only the World Economic Forum can do.
And these people actually sleep at night. Unbelievable. There have been, not the COVID, because that many people didn't die from the COVID. The COVID had a low kill rate. But they said close to 20 million people have died from the needle, the so-called cure. So the so-called cure was killing millions of people, and it's still killing people today. So, but this is who these are the type of people we're dealing with. The people that you're seeing right here up on your screen, straight up murderers. That's what they are.
Do to bring all of the actors together to address really important issues. I had the honor of serving as the chair of the Health and Healthcare Governors during January 2020's meeting when we first were planning for what we then know, of course, was a global pandemic. And I admired then, and I continue to admire now, how the World Economic Forum thinks ahead. And so, as Sham said, the goal of our discussion today is to really talk about what can we and should we be doing to make sure our health systems are prepared for any future crisis that might come along that requires global collaboration and participation, and how can we be sure that we learn from the past to strengthen systems for the future. And that will be the goal of our discussion today. We do have a very esteemed panel of experts here that I'm honored to introduce, and in introducing each of them, I'm going to ask them to give some opening comments as well about the key components, very briefly, that they each of them believe health systems should prioritize for an effective response to a potential crisis. And of course, it's our honor always to have Dr.
Oh, you mean the healthcare system, the medical system, the hospitals that actually murder people with the I forgot what you call them. Those oxygen machines, they stick the tube in your mouth to pump the air in your lungs. Yeah, they straight murder. They was murdering people all through those hospitals, all throughout the country. They was murdering folks.
Dr. Tedros with us, the
Same
Director
healthcare
General of the
system.
World Health Organization. And Dr. Tedros, may I ask you to answer that very simple question to start with? Thank you.
Can you rephrase maybe the question?
Yes, of course. At the highest level, what do you think health systems should prioritize for an effective response to a potential crisis?
Yeah. I think that's a big question, but I would like to start with especially the disease X. It's attracting a lot of attention, and I hope you have seen in the social media. But it's not a new idea. The first time we used the terminology was in 2018. The discussions were in 2017. I was just new Director General. As you know, we annually list the emerging diseases, and MERS could be one, Zika, Ebola, those we know. But then we said there are things that are unknown that may happen, and anything happening is a matter of when, not if. So we need to have a placeholder for that, for the disease we don't know. That may.
A matter of when, not if. So there you have it, people. They telling you right there in your face that another pandemic is coming. So you already heard it out of the horse's mouth.
May come. And that was when we gave the name Disease X. So Disease X is a placeholder for unknown disease. I just wanted to start by clarifying that because there is already a lot of attention. If I may, although COVID came immediately, we were preparing for COVID-like disease. You may even call COVID as the first disease X. And it may happen again. Of course, there are some people who say, oh, this may create panic. No. It's better actually to anticipate something that may happen because it has happened in our history many times and prepare for it. We shouldn't face things unprepared. We can prepare for some
unknown things as well, because there are basic things you can do. Then that takes me to your question, of course. Then we should prepare means it could be an early warning system that could be installed, and then preparedness planning. For instance, with COVID, we have seen it in preparedness planning when our hospitals were stretched beyond their capacity, but both in terms of space and also workforce. How can you have a surge when anything comes, you can expand quickly? So,
Man, y'all was murdering people in those hospitals. Oh, come on now. All throughout the country, y'all was murdering folks. People were being murdered, man. Murdered in the hospitals, murdered in the nursing homes. Man, these people, man. But they got the nerve to sit up there and you know, play this role of the savior when they're nothing but a bunch of devils, man.
you can manage your patients. We lost many people because we couldn't manage them. They
You murder many of people. Yeah, you murder many people. Let's keep it 100.
could have been saved, but there was no space. There was no enough oxygen. So how can you have a system that can expand when the need comes? This, whatever disease, you should prepare for it. You don't need to know the disease. There are common factors. In terms of supply chain, for instance, the same. So whether it's in health systems or even the private sector, by the way, in research and development, for instance, you can prepare for it. Actually started with this disease X issue with a research and development blueprint. It's a blueprint. And research and development should be at the center also to test drugs, to test the other tools. And then, of course, the health infrastructure. I said it a bit, but the health infrastructure is bigger than what I said, the oxygen and the space. So preparing that in all its forms, especially with a focus on primary health care. High-income countries were surprised because their investments in the last many decades was on high-tech technology, cutting-edge technology in tertiary services, even robotic surgery, but their investment in primary healthcare was not there. Even some countries couldn't do contact tracing. So to prepare countries, I think renewed commitment to strengthen primary healthcare is very important. So it starts from there, and then of course we can go. Then the other is we shouldn't see it in terms of health services, in terms of research development, and so on. We should see it also in terms of communities. I mean, communities can prepare for disease X. But there are many things that can be done at community level, and then public health education and communication should be at the center. So this is what I would like to say as a start. Thank you.
Thank you, Dr. Tedros. And we'll come back and drill down into some of those comments in a moment. Preetha Reddy, thank you for being here from India, where you and your family lead a very large healthcare system, Apollo Health. I would love you to introduce a little bit about yourself and your health system, and maybe also answer the brief.
Man, these people have no credibility, fam. No credibility. None. Zero. Zero. But they sit up here like, oh man, it's like nobody listens to them. But they sit up here like they on top and everybody else is down there at the bottom. They above everybody else. And we supposed to look up to them for the answers when they're not the answers. You know what I'm saying? They are the problem. Major problem. But if you point that out, what do? They want to censor you. They want to take your videos down, flag your channel. They want to do all that stupid shit. It's part of my language.
Brief question. What do you think health systems should do to prioritize?
So, I'm Preeta, Vice Chair of Healthcare, Private Sector Healthcare Group in India. We've been there for 40 years. What we've done in 40 years, I think the learning over the past, post-COVID, has really, intensified what needs to be done. And Disease X, I know the name seems like a science fiction film, but basically it's something all of us need to be aware and alert, definitely for future times to come, because it's definitely a clear and present danger. I want to draw an analogy.
Never no talk about building up your immune system. Notice you never hear them talk about that. You know what I'm saying? That you never hear them talk about building up your immune system. Well, number one, they're attacking the immune system. They're trying to destroy it. That's what they're trying to do. But I don't want to get too much into that because we already know how YouTube is. But never no talk about changing up your diet, exercising. None of that. Is basically put all your trust into these people, these liars, known murderers. Just, man, these people.
With the army, especially the Indian army, we know that every day the infantry actually prepares for war. They go through intense training, and at any time, if there is war at the border, they're ready to go and face that. I think healthcare workers, healthcare systems now have to look at the future like that at any time anything can happen, and we don't know which side it's going to come from, and there's no going away from that. So I think we have to prepare and be prepared. Like there are alerts for global scenarios. For us, it's usually cyclone or floods. There's a red alert or an orange alert. I think the red alerts have to be flagged much quicker, which means we need to be able to realize that this could be potentially a huge problem. And for that, there's been so much of discussion about AI and how can AI really help us to find and detect the problem so early that we can actually plan and prepare for interventions. I think that is extremely important. But more than anything else, I am a very proud Indian, and I think that the leadership, the quick decisions, and the incisive decisions to do what we have to do at the right time. Sometimes they're hard decisions, you face that, but I think to take the right decision, the hard decision, but to take a decision has been very important. And I think a population of 1.3 billion people, if we have been able to come out of this relatively, better than which could have been.
She's talking about numbers. You do know they want to kill and wipe off billions on this planet, right? I'm sure a lot of you already know that they want billions and billions of people deleted from the planet, from the globe. And you looking at the people right here that is pushing that. Depopulation, baby, that's what it is. That's what it is. You know what I'm saying? Let's keep it real. Let's keep it 100.
Have been anticipated, and the fact that there was early intervention of vaccination, there was a lockdown. It was hard, but it was a decision making which I think helped us. So I think that's important going forward.
Thank you, Preeta. Next, Roy Jacobs, who is the Chief Executive Officer of Philips Healthcare. Roy, I'd love you to say a little bit about your company and give us your perspective.
Yeah, thank you so much. Philips, 33 years old. We're focused fully on delivering healthcare solutions now, and we were very active also during COVID. And I think some major lessons we learned as a company, but I think also we should take away for the healthcare system. First of all, it's all about the patient. And I think that one of the big learnings during COVID was that actually you cannot treat the patient maybe like you would normally do, because you need to isolate, you cannot touch the patient. Also, what are the specific means that you need to ramp up very quickly, like respiratory devices, monitors? We had, of course, the vaccines. And how do you mobilize a supply chain globally to actually do that? So I think that's the second big lesson. Thirdly, it's all about the staff that needs to take care of these patients. And very quickly we saw that actually it became more and more challenging for the healthcare systems to actually keep the staff up.
All right, family, I'm going to go ahead and end it right here. So these people are getting ready to release another disease that we already know that they've created in the lab. So they want to get ready to release that. Well, it's not one, they are. So it is what it is. All you got to do is just, now is the time to take care of yourself, take care of your health, do whatever you can to make sure that your immune system is where it should be. If you drinking, smoking, I would suggest that you just cut that out immediately, because man, these people mean business, man. They mean business, man. They're not playing. They're not playing. They're actually going to try to go through with another pandemic, which is crazy and insane. I mean, you think the first pandemic was bad? That ain't nothing compared to this one that's gonna be released, and we don't even know for sure if it even be a pandemic. They might do a cyber attack, which is even bad too. But they're talking about, there's things that have been said that this next disease could have like a much higher kill rate. It's saying like 20 of like 20 million, 50, all the way to 50 million could be killed from this disease X that they are going to release out of the lab that they've created. So COVID had a very low kill rate. What was killing people was the so-called cure. And we already know what the so-called cure is. I don't even have to say it. We already know what that is. But I'm gonna leave you with this. Like, these people mean business. They they want people deleted. They want people basically wiped off the planet. Well, ain't no basically. That's what they want, and they they are they got their mind set, and they are determined to go through with it. So just protect yourselves. It's a little bit of a reaction video I wanted to share with you. I thought it was pretty interesting, so I said, you know what, man, I'm gonna share it with the people, man. So take care of yourself. More importantly, take control of your health, because taking control of your health nowadays is considered a revolutionary act. So I'm out, family. Peace and love.